to the channel. This is Dang GH YouTube platform, your #1 live in the UK test learning platform, as well as UK NMC CBT exams. So if this is your first time, kindly check out our YouTube channel. The amazing video that we've made concerning CBT, that is for all specialties, then live in the UK test as well. In addition to that, we have amazing videos for your OSCE preparation, so you can check that one as well. Thank you. On today's edition, we will be continuing from where we left the other time. That is the second episode that we did. So I was talking about the NMC Code of Conduct, and I did explain how this will help in your CBT preparation. So what I did was I gave you overview of the NMC Code of Conduct, that is for the first episode. Then I started picking up the core principles of the NMC Code of Conduct, which were practice effectively, prioritize people, promote professionalism and trust, as well as preserve safety. So in our previous videos, I did start with the prioritize people, what it means to put the patient or the service user first. So what we will be talking about in this edition is the practice effectively, which is another core theme of the NMC Code of Conduct. This aspect is very broad, so what I will do is in case I don't finish in this video, it means the next video will be a continuation of the practice effectively aspect. What this core theme tries to tell you is regarding your practice as a nurse or as a midwife, what you can do to enhance it and improve on your performance or your practice. So it will be talking about communication, working within teams or working among other professionals as well. Then how to update your knowledge, that is keeping up to date with current practices, as well as feedback, that is in case someone gives you a positive or negative feedback, how do you build on these things? So that is what I'll be explaining to you. To start with, that is a preamble. Practice effectively. As you can see on your screen, they will just give you overview of what it means. So this one is saying you assess need and deliver or advise on treatment or give help, including preventative or rehabilitative care without too much delay and to the best of your abilities, on the basis of best evidence available and best practice. You communicate effectively, keeping clear and accurate records and sharing skills, knowledge and experience where appropriate. Then you reflect and act on any feedback you receive to improve upon your practice. Whenever you are giving care, it has to be very swift. You don't need to delay the care that you will be providing for people. To break this down to you, what they mean is whenever you are providing care, you need to be very swift with it. You don't need to delay the care that you are providing for someone. It goes beyond just the care, that is when it comes to reporting. Okay, so for instance, incidents of safeguarding, that is you protecting a vulnerable someone. How do you report? So it should be very immediate, it should be without undue delay, or it should be urgently. These are the key terms that you will be using. So you should look out for words like urgently, immediate, undue delay, as soon as possible. These are the key terms that you'll be using to describe the care that you'll be providing for someone without too much delay. Then you provide care on the basis you provide care on the basis of best evidence available. So this one is talking about research. So nursing is informed by research. It means that whatever care that you are providing, what does research says about it? So maybe you are comparing two things, which one is approved and backed by science. That is what it means. So you cannot just render any care anyhow to anyone without any justification as to why you think this is the approved way or the other way around. So that is why you need to stick with organization policies. You need to stick with NIC guidelines, because these are formed data or information. It means that they've conducted research and seen that this is the best way to do this. So always remember, research, evidence, what based. Then you communicate effectively. So when you are communicating, your speech should be clear. You should check for understanding. That is when you give out information. Maybe I want you to do this. Check if the person really understands what you are saying. Don't use too much scientific terms, especially when you are educating patients. It should be simple, clear language where the patient can understand. Then in addition to that, you don't use medical terms or jargon, because the patient will not be familiar with these things. Then when you are also communicating, you should be very, very sensitive. Okay, some information are very, very vital, and you have to find a way to communicate this information. So for instance, during end of life care, that is the patient dying, how do you communicate or how do you lay such information to the patient? So it should be sensitive. Keep clear and accurate records and sharing skills, knowledge, experience where appropriate. So you should share knowledge with your colleagues. If your colleague doesn't know something and you know, you shouldn't sit on information. And also you should share knowledge to protect patients. So assuming someone has been abused sexually and you are caring for the patient, maybe you might just be a general nurse. Do you understand? But once you share the information with the other team members, that is the safeguarding lead, maybe a psychologist for psychological interventions, then it means that you are sharing knowledge, okay, and information, so that the person can be best protected. Then clear and accurate records. So whenever you are documenting, it should be clear. Your handwriting should be legible. It means that we can look at it and read. That is what the legible handwriting means. Clear, legible. And you shouldn't include jargons or shortcuts. Okay, so blood pressure, then you write BP. No, it should be clear and legible. And it should be accurate as well. That is, you record facts. Okay, so patient went to the toilet. That is, if that is what the patient did, it's a fact, you write. Okay, you don't include your opinions. Patient went to the toilet because I think she wanted to use her phone. No, that one is something that you cannot prove. But patient went to the toilet, that is a fact. So that is clear and accurate records without you including your opinions, your judgments. Then you reflect and act on any feedback you receive to improve your practice. That is, in your line of care, people will give you feedback. That is, once you communicate, once you render care to someone, they will give you feedback whether the care that you provided, they were satisfied with it or not. So you are to reflect on those feedback, that is either positive or negative. So if it's a positive feedback, you think about it, what you did right, and you inculcate that one in your practice. If it is something that you did wrong, you think about it, then you realize your mistakes, then you correct them so that you don't repeat those mistakes again. So that is what it means by you reflecting on feedback to improve your service. So reflection is very, very important in your nursing practice. I'll do a whole video on reflection, ways to do reflection and all that. So that is just the preamble for you. Now I'll be breaking down what you'll be doing to demonstrate all these things. Then right after that, I'll put some questions at the end of the video for you to try your hands on. Then you give me your answers at the comment section on YouTube. So that is what you'll be doing. The first one is always practice in line with best available evidence. And for you to achieve this, you make sure that any information given is what? Evidence based, including information relating to using any health and care product or services. Then next one is maintain knowledge and skills you need for safe and effective practice. So as I said earlier, whatever information you give should be what? Factual. A patient asks you any information and you don't know, just be honest with the patient that as for this one, I don't know. So probably I'll go and read more on it, or I'll ask a senior colleague to assist me with this one. The reason is we are prioritizing patient safety because we don't want a situation where you give a false information and the patient will go and act upon it and there will be a harm caused. That is why it is very important that you give out accurate information, something that is backed by science. Do you get it? And it says information relating to using any health and care product. So maybe when it's a product that you are recommending, is it proving that this product works? So that is something that you should be well aware of. And this one also helps to build trust within the healthcare system, because when I come to the healthcare facility and the information that I'm getting is wrong, okay, these are concerns about health. So once the person does not have that trust, it becomes difficult for you as a nurse and even the patient as well, because you are going to a hospital and you have no idea what to expect. So that is why whenever you give out information, it should be what? Evidence based, something backed by science, or the organization has approved, your trust has given approval that this is the best way we go about this one, then you just go by that. Then maintain knowledge and skills. That is, you should be doing your trainings. That is both mandatory trainings and statutory trainings as well. Communicate clearly. That is the next one. So that is, use terms that people in your care will understand. Don't go too scientific terms, jargons, because the patient wouldn't get the full understanding of what you are saying. So use simple, clear terms. Then take reasonable steps to meet people's language and communication needs, providing whenever possible assistance to those who need to communicate their own or other people's needs. So take reasonable steps. If the patient will need help with communication, okay, the necessary risk assessment has to be done. Then you provide appropriate communication aid for the patient so that they can verbalize whatever they want or their wishes. And another thing is, if the person does not understand English, you should be able to book a professional interpreter, so that every aspect of communication will be interpreted for the client or for the patient. And now I've made a whole video to explain this, so you can check that one on the YouTube platform. So communication, if the person does not understand English, use the services of professional interpreter. Don't let a family member interpret, don't let another staff interpret. The reason is it could be breach of confidentiality, and other times there will be conflict of interest regarding that one. So let a professional interpreter do that thing for you. Then you should be using range of verbal and non-verbal communication methods, and consider cultural sensitivities to better understand and respond to people's personal and health needs. So verbal and non-verbal communication. You should always use open body language. Okay, open body language. Then you maintain eye contact, but you shouldn't be staring at the patient, So it should be open body language, where you don't have to be crossing your legs. Okay, you shouldn't be relaxed in a chair. This gives the impression that you don't care about what the person is telling you. So this one, there's another topic that is solar, that explains this in a much perfect way. So I'll be doing the topic solar to explain communication aspect, that is open, close body language and everything. But this is to just give you the understanding that when communicating with patient, you should use range of verbal, non-verbal, your body language. What are you saying? Are you giving the person distance and everything? So that is something that we can discuss. Then check people's understanding from time to time. So if I tell you maybe take this medication, one in the morning, one in the evening, I should check if you understand. So hello, do you understand what I mean by one in the morning or one in the evening? And the patient will say maybe yes. So if I say take one in the morning and one in the evening, how do you understand it? And maybe the patient will give you feedback, so that you can be sure, okay, that you really understand the information that was given. Then be able to communicate clearly and effectively in English. So once you are a registered nurse or a midwife, you should be able to speak English, and that is a requirement. So that is why you need to write either IELTS or the OET to demonstrate that you can communicate effectively in English. And I think now they have what we call employer reference, where your employer can give you reference to demonstrate that you can speak fluently in English. Moving on to the next one, that is work cooperatively. So as a nurse, you work within a multidisciplinary team. So when we talk of multidisciplinary team, it means that various professionals coming together to render care to someone. So you might have nurse, you might have psychologists, you might have the doctors, you might have midwives, all of these professionals coming together to render care for the patient. So this ensures that the patient receive a holistic care, that is, all aspect of care is being catered for. So what you need to know is you need to know the various professionals and their roles. So when we talk of social worker, what does the social worker do? When we talk of physiotherapists, when we talk of speech and language therapists, when we talk of tissue viability nurse, what is their role? When we talk of the nurse, midwife, and occupational therapist, which I've talked about, what is their role? So I will do a whole video on that one as well, to explain the various professionals and their role. Then I'll put out some questions so that you'll be able to clearly understand it. You need to respect the skills, expertise, and contributions of your colleagues, referring matters to them when appropriate. That is, there are other professionals, so you need to know when a certain case goes beyond your expertise. So assuming maybe you are a nurse, you are addressing wound, and the wound has not been healing, and you think you need to refer, who do you refer to? Then you get to know that it is the tissue viability nurse, because they are more specialized in wound care. So you need to know when certain things falls out of your expertise and refer to the colleagues immediately. So that is where the immediate aspect comes in, undue delay. Then maintain effective communication with colleagues. Then keep colleagues informed when you are sharing care of individuals and other healthcare professionals and staff. Then work with colleagues to evaluate the quality of your work and that of the team. Share information to identify and reduce risk. So as I said, you need to share information. Example, when it comes to issues of safeguarding, you need to tell maybe your safeguarding lead that maybe you suspect that this person has been abused. So once you share that information, it means they need to work on safeguarding that person, and this reduces the risk of further abuse. Then lastly, be supportive of colleagues who are encountering health or performance problems. However, this support must never compromise or be at the expense of patient safety. What this means is if your colleague needs assistance, okay, in keeping up with their health. You should be supportive as well as performance. That is, if something is hindering their productivity. Now, what this means, okay, because they added the second clause which says that, however, this support must never compromise or be at the expense of patient for safety. So assuming your other colleague doesn't know how to maybe give an injection, this is just a scenario, right? And it says that be supportive of friends or colleagues who are encountering this is a performance problem because they cannot do such thing. But however, if you teaching them, it means that using patients as a try and error, then it means it's very, very, very wrong, because it puts the patient at what risk. So you cannot give that kind of support in this scenario. However, what you can do is to let your line manager know that this person does not know how to do this. Okay, so maybe what can we do to assist? Maybe we should assign the person a training to do, or you can encourage the person to talk to the line manager. That is you offering that support, that encouragement. All these are kind of support. Also, you can provide information on certain aspects that maybe when you are not confident in this is where you can get information regarding this. So for example, that is someone having health related issues, maybe they are stressed. You can suggest that maybe you should go and see the occupational health department, or maybe you can talk to the line manager. If there are other supports available for them, you can make it known or share with them. That is you supporting them.